My name is Nick Manteris. If you're watching this, you probably already know that. Most everybody that's watching this video is going to be a patient that's currently active in our clinic. I am the treating doc here at Broomfield Spine Injury. The reason why I'm making this video, it's supposed to be a very short introduction to who I am. It's important for me to know what the experience was in the past personally of my healthcare providers. The injuries that they've had, the illnesses and conditions that they've dealt with them and their families, that all affects the way they treat. And if I'm a patient, I want to know where that's coming from. And, you know, most of you know what the rhythm is like, the flow is like in this clinic. We don't have a lot of time to get into my past history, and we shouldn't. You know, this is about your care, right? We're here for you. So this is available for you to watch if you like, all right? As a kid, I was not athletic. I was one of the lucky ones that was just riddled with injuries all the time. Not little injuries, like really big ones that put you in casts for a long time. By the time I was in high school, all right, whether I didn't really recognize it at the time, but I had injuries. I was actually suffering with clinical depression. Health was on a downward spiral. All right. By the time I was out of high school, depression didn't just go away, and then there was, you know, quite a bit of ways that you deal with that in really harmful ways. A lot of substance abuse, a lot of bad relationships, and you know, I think any of you watching this that have been through that know that it just gets worser and worser, right? So for most chiropractors, here's where they step in and say, "And I had this chiropractic miracle, like this chiropractor." That's not what happened to me. Okay. So look, chiropractors have always been there for me my entire life, and I love chiropractic, but truly what got me out of it was three things. My mom, exercise and nutrition. And you know, to be super candid, I mean, I almost died, right? It was pretty serious. And those three things really did save my life. So I spent, 10 or 12 years doing fitness in the fitness industry with a basis in nutrition. And ever since then, I keep trying to pursue health, not just for me, but anybody around me. Everybody comes into the gym with pre-existing conditions. They've got injuries, and trainers, we try to work around them or we try to fix them. It wasn't enough for me, so then I got into physical therapy. And when I got into physical therapy, I did a whole lot of orthopedic rehab, hip replacements, knee replacements, spinal fusions. And I think I was pretty good at it. You know, I did high volume, I did a lot of patients, I had some incredible mentors. These doctors of physical therapy were brilliant, and I'm grateful. But it was depressing. The age kept getting lower and lower for these hip and knee replacements. These spinal fusions were just going through the roof as far as volume goes. And I wanted to try to get to people before they got into the situation. And so in my late 30s is when I actually considered being a chiropractor. I never ever considered it earlier. It was not something that was even on my radar. But this was the answer. And so, you know, here I am, right? 4 years we've been in this location. We spent 2 years in Texas prior to this. That's where I'm coming from. Look, I've had more injuries than anybody in here, probably than 10 people put together. Just lucky that way. But instead of being really depressed and bummed about it, I gotta be honest with you, I really feel like it gives me an advantage. You know, when somebody dislocates their shoulder, I know what that's like. When somebody has to go in for reconstructive, I know what that's like. Neck pain, back pain, auto accidents, you know, I have more than my share of all of this stuff, right? Really, really serious stuff that's needed treatment, and I've needed care from all kinds of different providers. I love chiropractic, and these guys have been amazing to me, for me, but they weren't the end all, right? I've had my share of surgeries, I've had my share of pain management. There's a lot that goes into health, and a lot of times we are not the end all. And I think it's really important that we're able to determine what the extent of our intervention is going to do for our patients, and make sure that if it is not going to take care of the full problem, then let's get these patients to somebody who can take it all the way home. So that's just a little bit about me. It's why I'm here. It's why I'm here for you. I do not mind talking about it. It's just obviously not something that we have a whole lot of time for in here. The rule stands. If you ever want to have a chat, you all have my personal cell phone. Call or text me, and we'll sort it out. And I'm honored, and I really appreciate you taking the time.